Nurses need to understand health and wellness because their definitions largely determine the scope and nature of nursing practice. Clients' health belief also influences nurses' health practice. Some people think health and wellness or well being as the same thing, or at the very least as accompanying one another. However, health may not always accompany wellness. A person who has terminally ill may have some sort of sense of well being. Conversely, another person may lack a sense of well being yet be in a state of good health. There is no consensus about any definition of health. There is knowledge of how to attain a certain level of health, but health itself cannot be measured. Health is highly individual perception that we can understand by considering the following examples of individuals who would probably say they are healthy even though they have physical impairments that some would consider an illness. Let's consider some examples of individuals who are having physical impairment but have some sense of well being. In first example, Devon Dubrowski, a 15-year-old with diabetes, takes injectable insulin each morning. He plays on the school soccer team and he is an editor of high school newspaper. Even though he has impairment, he is able to be active and to do what he wants. In the next example, John Talbot, 32 years old, is paralyzed from waist down and needs a wheelchair for mobility. He is taking accounting at a nearby college and uses specially designed automobile for transportation. He can able to be in good spirit most of the time. So he is also able to do his maximum by using available circumstances. In another example, Susan Helmer, age 72, takes antihypertensive medications to treat high BP. He is a member of neighborhood golf club, makes handicrafts for local charity and travels 2 months each year. So these characteristic indicates that health is not something that a person achieves suddenly at a specific time. It is an ongoing process, a way of life. From the above example, most people define and describe health as the following: being free from symptoms of disease and pain as much as possible, being able to be active and to do what they want or must, being in good spirits most of time. So we have seen individual definitions of health. Let's see Nightingale definition of health and WHO definition. Nightingale defines health as a state of being well and using every power the individual possesses to the fullest extent. Whatever power the individual has, he or she should be able to do or use that power to the fullest extent. That state of being well is said to be healthy according to Nightingale. According to WHO, state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. An individual is not said to be healthy just because of the absence of disease or infirmity, but he or she should completely, physically, mentally and socially in a state of wellness in order to said to be healthy. Dimensions of health. Health dimension means these are variables which influences a person's health status, belief and behaviors. There are two types of variables, internal variables and external variables. Internal variable means it is internal, includes biologic, psychologic and cognitive dimensions. They are often described as non-modifiable variables because for most part they cannot be changed. And external variables are external, they are modifiable, they can change. For example, standard of living, family and cultural beliefs, environment, etc. When internal variables are linked to health problems, the nurse must be even more delicate about working with the client to influence external variables such as exercise and diets that may assist in health promotion and prevention of illness. Let's see internal variable first. It includes biological dimensions, cognitive dimensions, and psychological dimensions. Biological dimensions include age, sex, genetic makeup, and developmental level. Let's see biological dimensions in detail. Age is a significant factor. Distribution of disease varies with age. For example, arteriosclerotic heart disease is common in middle aged males but occurs infrequently in younger people. Communicable diseases such as whooping cough and measles are common in children but rare in elders who have acquired immunity to them. Next biological dimension is sex, which influences distribution of disease. Certain acquired and genetic diseases are more common in one sex than in another. Disorders are more common among females includes osteoporosis and autoimmune diseases like rheumatoid arthritis. Those are common among males are stomach ulcers and abdominal hernias and some respiratory diseases. Genetic makeup influences biologic characteristics such as activity level and intellectual potential. It has been related to susceptibility to specific diseases such as diabetes and breast cancer. In some cases, genetic predisposition for health or illness is enhanced when parents are from same ethnic genetic pool. For example, people of African heritage have a higher incidence of sickle cell anemia and hypertension than the general population, but may be less susceptible to malaria. Developmental level has a major impact on health status. Let's consider some examples. Infants lack physiologic and psychologic maturity, so their defense against diseases are lower during the first year of life. Toddlers who are learning to walk are more prone to falls and injury. Adolescents who need to conform to peers are more prone to risk taking behaviors and subsequent injury. Declining physical and sensory perceptual abilities limit the ability of elders to respond to environmental hazards and stressors. Next internal variable is psychological dimensions. Under psychological dimensions, there are 2 points: mind body interactions and self concept. Let's see mind body interactions. Mind body interactions can affect health status positively or negatively. Emotional response to stress affect body functions. For example, a student who is extremely anxious before test may experience urinary frequency and diarrhea. Prolonged emotional distress may increase susceptibility to organic diseases or precipitate it. This emotional distress may influence immune system through central nervous system and endocrine alterations. And these alterations in immune system are related to incidence of infections, cancer, and autoimmune diseases. Next psychological dimension is self concept. It is how a person feel about self. For example, an anorexic woman who deprives herself of needed nutrients because she believes that she is too fat, even though she is well below an acceptable weight level. Here, her self concept is responsible for her health status. Next internal variable is cognitive dimensions. Under cognitive dimensions, there are 2 points: lifestyle factors and spiritual and religious beliefs. Let's see lifestyle factors. Lifestyle is referred to as behavior and activities over which people have control. The lifestyle choices may have positive or negative effects on health. Practices that have potentially negative effects on health are referred to as risk factors. For example, overeating, getting insufficient exercise, and being overweight are closely related to the incidence of heart disease, arteriosclerosis, diabetes, and hypertension. Next cognitive dimension is spiritual and religious beliefs. Spiritual and religious belief can significantly affect health behavior. For example, Jehovah's Witness oppose blood transfusions. Jehovah's Witness is a Christian denomination. They are opposing blood transfusions. Some fundamentalists believe that a serious illness is a punishment from God. And some religious groups are strict vegetarians, and Orthodox Jews perform circumcision on 8th day of male baby's life. These are some religious and spiritual beliefs which affect health status of a person. So we have completed internal variables and the dimensions of health. Next is external variables. They are environment, standard of living, family and cultural beliefs, and social support network. These factors can influence health status. Regarding environment, people are becoming increasingly aware of their environment and how it affects their health and level of wellness. Geographical location determines the climate, and climate affects health. For example, malaria and malaria related conditions occur more frequently in tropicals rather than in temperate climates. Next external variable is standard of living. An individual standard of living, which reflects occupation, income, and education, is related to health, morbidity, and mortality. Hygiene, food habits, and seeking healthcare advice and follow health regimens vary among high income and low income groups. So, depending upon this standard of living, health status also vary. Next external variable is family and cultural belief. Family passes on patterns of daily living and lifestyles to offspring. For example, a man who was abused as a child may physically abuse his small son. So, a climate of open communication, sharing, and love fosters the fulfillment of person's optimal potential. Next is social support network. Having a support network, including family, friends, or confidant, and job satisfaction helps people avoid illness. Support people also helps the person to confirm that illness exists. People with inadequate support networks sometimes allow themselves to become increasingly ill before confirming the illness and seeking therapy. Thanks for watching. Please do subscribe my channel for more videos on nursing.